Hey, DPC docs, listen up because the big, beautiful bill just passed, and we know you've got questions. What does this mean for HSAs? How does it impact your patients or the future of DPC? My DPC Story is teaming up with the DPC Coalition to bring you answers. Head to mydpcstory.com/contact and leave us a voicemail with your questions, and we'll be covering them in upcoming episodes. Again, that link is mydpcstory.com/contact to leave us a voicemail. Elation Health wants to support all those looking to start their own DPC practice. For that, they created a checklist for how to launch your own practice. Learn everything you need to know about planning to open a new DPC practice, from Medicare opt-out requirements to legal advice, financial support to marketing know-how, and the technology resources available to DPC physicians. With Elation's EHR, ensure your patients receive high-quality, proactive care through an intuitive clinical workflow while reducing manual work and charting time. Elation Health's EHR supports you throughout all stages of your DPC journey. Visit elationhealth.com/mydpcstory to download today. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Well, I am still in New Orleans physically, and Dr. Haug is joining me from his neck of the woods in Pennsylvania. We have just come from the 2025 DPC Summit. And Dr. Haug and many people who were in person got our Battle of the EHR results. We have our Toolkit magazine. If you have not gotten a copy, or if you weren't at the summit, you can go to mydpcstory.com/magazine and you can check out a digital copy there. But Dr. Haug has joined us today to give his perspective on the data that the Battle of the EHR said, as well as him as a very seasoned DPC physician with multiple people working at his clinic, clinicians and support staff. He had just a fun time hanging around and asking the different EHR vendors at the summit about their products. And so conversation is all around the EHR and his opinion as a seasoned DPC doctor, as well as the data from the magazine. So thank you so much, Dr. Haug, for joining us today.
Thank you for having me. It's good to see you again so soon.
I know, it's awesome. Tell us a little bit about your practice for people to understand in terms of how you've transitioned over time from you opening to where you are now, and in terms of how your EHR has helped you serve patients as well as yourselves to manage those patients.
Sure. Yeah. So I opened in 2016 and started with 30 people or something. And then over the years, we've grown not only in terms of the number of patients, the number of docs, but also expanding in 2022 into a second location. So that was an adjustment, especially in the EMR, where you're trying to figure out two different inventories, two different messaging systems. You have team members in one location, team members in another location, portals, all that sort of thing. So that was kind of an inflection point on, okay, where are we? And then also from a billing standpoint, everything has gotten a lot more complicated for us. So we've been kind of managing that and communication platforms. So I started initially just with an EMR, and then over time we've added communication platforms, billing platforms, and we're still always trying to see how to maximize the efficiency of all of those things.
And this is so important because I think that, especially coming off of DPC Summit, where there's a lot of people who are coming to learn about DPC, there's a lot of people who are learning about the tools we have available to us in DPC, and the people who are already planning their opening date. as well as people who are looking in our battle. It was insane. Over 20% of the respondents in our survey, we had 214 people taking our survey, said that they were looking to switch EHRs. So here, I'd love if you can tell us a little bit more about what overall goal you wanted to achieve by adding different parts of your tech stack like you talked about, especially because you have multiple physicians, multiple locations, and multiple years and multiple patients.
Yeah, I mean, I think with each development, as you grow and as not only a doctor but a business owner, you're constantly thinking about, okay, how can we streamline the workflow, not only for our patients, not only for me, but for the entire team? How can we make this much more efficient, then more user friendly for patients? And then from a billing standpoint, how do we make sure that we can run all the reports we need to run and manage all the finances the way we need to? So it kind of came in different iterations, but I would say the first one was with the communication platform, because when you start adding multiple docs, you have to have a way to kind of filter those messages, text messages to each person individually. And then also if we had prescription refills or triage questions, we wanted to be able to filter that to our nurse. And then if it was more admin or somebody who was interested in joining the practice, we wanted that to go to, we call it our patient care coordinator. And so it's just, how do you make sure that you're able to get those messages as efficiently to the proper person who can answer that?
Totally. And I think about, as you're talking about that workflow, how many clicks does it take to do those? And how many clicks could it take if workflows were optimized? So I would love here if you can tell us about your experience at DPC Summit, because again, you are a person who has a practice that probably many people who went to DPC Summit will be very soon here, because so many people are looking for DPC. And I'm just wondering if you can walk us through, what are the important things that you were listening for, or what are the things that you were asking? Because we had an entire article rooted in Dr. Jalen Pritchard's How to Choose an EHR That Grows With Your Practice. And it had a worksheet where you could ask questions. But my biggest thing that I was very intentional about was a whole column of, what do other DPC doctors say about the EHR that you're talking to? And so highlighting your version of these answers, what types of things were you picking up on and interested in and hopeful for or frustrated with?
Sure. Yeah. Yeah. The conference, I mean, the conference was awesome this year. And I wasn't able to go last year, but did go 2 years ago, and many of them before that. And it was just remarkable to see the growth. Like, I mean, going in the first lecture, I couldn't believe how many people were in the room and the number of vendors. I mean, back in 2016, I think there were like 5 vendors at the conference, and now there were, I don't know how many, 50. But part of why I wanted to go, I mean, there's always new things you can learn. There's always new ways that we can become more efficient. And the beauty of the movement is that it's becoming so popular that there's just a number of companies now that are looking to target direct primary care, and how can they help direct primary care get better. So yeah, it was great to see all the different vendors. And I was looking at different EMRs that weren't even in existence in 2016. So things have come a long way. And partly for me was kind of adopting new technology. So what kind of AI tools are incorporated? Because we have an interest in that in a lot of our docs in terms of helping with notes, but also AI is so sophisticated, you can actually say, hey, can you pull in my last 2 office notes and a hospital discharge summary and write a brief summary prior to my visit here, or those sorts of things. So there's so much power AI is going to be able to incorporate into making our lives a little easier and also more efficient with office notes and population management and that sort of thing. So I wanted to look at kind of where things were in the AI space, where different companies are looking to move that. Population health type things. And part of that is because of working with businesses is when you start to work with businesses that are a little bit larger, it's nice to have some sort of data. And I'm not talking about all the that kind of stuff. I'm talking about like how many times did they come into the office? How many times did they text? You can even look at what kind of new diagnosis were did you have? Just like what is the engagement data, right? And I think that's really important. I think it's also nice as now that we have so many patients, we're at like 2,500 patients, it's how do you make sure that you're not letting people fall through the cracks? So if there's a way you could say, which one of my diabetic patients has not had an A1C in the last 4 months? And then you can send out a message, say, hey, you due for your blood work, get that in. Or who hasn't gotten their colonoscopy? And can we reach out and say, hey, you know what? Notice that you haven't had your colonoscopy, but we're due. And what kind of tools can help us do that? So that was one of the things I was looking for. And then a big thing too is like just how user friendly it is on mobile phone, because we're out and about. And if you're the one running the practice, yeah, you're in the office seeing patients, but sometimes you're at meetings, you're working with vendors, you're doing admin time at home, and you want to be able to like quickly on the fly be able to take care of patient care on your phone.
It's so true. And especially because we are so not 8 to 5 in the office because we have to be a type of people anymore in DPC. That accessibility, it's absolutely something that was echoed in the Battle of the EHR data that we have from this year's survey. And I'm wondering here too, as you talk about AI, I would love to just hear your take on how this enhances the patient's experience, because it's part of how they love our practice is how they love our tech. And I do feel that that impacts how people either stay or churn at a practice. It's not going to be the highest thing that impacts churn, but I do think that it does impact churn, especially with word of mouth, if a person has a bad tech experience.
Yeah, I agree. I think, well, I will say just the accessibility over messaging. I mean, patients absolutely love that. And it's a big separator from the large university health system based primary cares that a lot of us came from, where you can handle so many things just by doing quick. I mean, the amount of patients I took care of this morning just by texting them, patients sending pictures over about rashes, and I could quickly write them back, make a suggestion, and say, hey, send me a picture next week. And they didn't have to leave their house or work to go do that visit. That people love that. And that's something that will want them to stay with your practice because they know they can't get that type of convenience elsewhere. I think the AI, I mean, one, as it continues to morph, it's going to be really helpful with triaging and quickly triage patients and help all of us make decisions easier. But also just the engagement in the office visit. I mean, I think one of the things that we do really well in DPC versus other places is we take time with patients, we look them in the eye, we sit down and do that. But if you're sitting there typing a note, I mean, it does still can take away from that. Whereas if you're have an AI scribe where you can just sit and put your computer down and just be really present, I mean, that can even take that doctor-patient relationship to the next level there. So I do think there's a real value in how that can continue to foster that great relationship, which then fosters all the patients telling all their friends and family and people in town how great your practice is.
Absolutely. And it totally feeds into the culture of accessibility. And so it is really important to look at a DPC focused EHR versus a non-DPC focused EHR, one that's really focused on coding and optimizing codes and billing. And so here I'm wondering, thinking about, because you've been in practice for over 8 years now, you're nearing a decade of practice. Like we talked about, you have multiple doctors, multiple staff, multiple locations. I'm wondering if you could reflect on your own journey in the beginning to now. Was there anything that you had, as you were building your tech stack, thought, this is okay, it's good enough, but looking back now, you're like, I wouldn't have gone with that had I known this or had I known that?
Hmm. I mean, I don't know if there's anything where I wouldn't have gone with that. When I started out, well, one is usually you don't starting with a bunch of money. So you have to think about, okay, how can I have a tech stack that's going to meet my needs, but not break the bank? And I opted for an all-in-one management tool. Had portal inventory management. I could set up like my phone. It had some texting feature and then could also manage our subscriptions. And I just like the idea of everything together in one system. And that worked for a while, but then you get to the point where it's not meeting the needs of the communication platform the way we would need. And so then I looked into adding a communication platform. And then as we continue to expand and we opened a second location and had multiple providers where we're trying to calculate, what their income is and all of those things, we needed a billing platform that is going to be able to really handle all of that. And so I don't really have any regrets in terms of like that. I mean, I think it was just more of there's a transition over time and you start adding stuff. Now the question I'm having is am I doing it the most efficient way? Or now that we've kind of expanded and added all these things on, is there a different way where I can even make this more efficient and better? So I think like all of us, we're always looking at, okay, what can we do here? I mean, changing your EMR is a major overhaul. It's a little anxiety producing, so it's not something I would ever take lightly. But you also have to think about, well, how's the technology changing and what might be a better fit?
So here, thinking in a completely utopian world, if a patient were to come into your practice all the way to follow up after their first appointment, what is the perfect workflow for your team at Core Family Practice?
Well, so if it's a patient who's interested in joining the practice and decides, yeah, I want to sign up, then I like them to be able to sign up online, complete their registration, initial documents, everything's ready to go, automatically uploaded into the EMR. Once that patient signs up, they're automatically uploaded into the EMR, the billing platform, and communication platform seamlessly. We don't have to manually change things. And then typically we'll reach out, obviously, and set up an initial appointment. Then when we have them come in and do their initial appointment, I mean, it'd be great to just spend an hour with that patient. Ideally, all the records are in. Obviously, that doesn't always happen, but and then you can sit there and have a nice conversation. We do have patients do an intake form prior to coming in, and then have that populate the chart. Personally, I would like it to populate the chart a little better than it's currently doing, but that would be nice. And then that way you come in and everything's already preloaded and all that. And then we can sit and kind of go through an initial visit. If we had AI, which could help produce that note and also patient summary at the end. So at the end, that patient summary, I like to load on the portal. And that way I feel like we're both on the same page in terms of what the game plan is, and something where really easy for the patient where they can get on and they could access that. I mean, if it's an app or something, that would be great, but something where they can say, okay, this is my medical home, this is where I go, and I can get all my information real easily. And then if I have questions, I can send a quick message, and that message will be sent right to my doc so they can answer it. If I need a follow up, I can either call the office or send a message, or I could go online and maybe schedule an appointment and get my follow up booked.
Totally. And this is very similar to how our workflow works at Big Trees MD, and also how you guys have intentionally designed your workflow to work so far. What about the back end in terms of you go through the patient experience like you described, they have their after visit summary, but then they need labs, they need orders executed on. What's your ideal workflow, or how are you doing it now? Or what would you like to do in the future so that your efficiency is optimized?
Stay with us. We'll be right back.
Thinking about hiring a virtual assistant but not sure where to start? Cool Blue VA does more than place VAs. They partner with your practice. From a full practice audit to help you uncover what tasks to offload to 80 hours of free trial support, they help you figure out what to delegate and when to hire. We dive into all of this in our latest episode, so don't miss it. If you're at the DPC Summit this week, visit Justin at the Cool Blue VA booth in New Orleans. And if you can't make it, be sure to catch the episode and learn how to get 80 hours free of VA support for your DPC practice. Find the episode in your podcast feed or check out the link in the show notes. Are you a DPC provider tired of EHRs that feel like they were built for someone else's practice? Serbo was specifically designed for practices like yours, cash-based, membership-driven, and focused on building relationships, not red tape. With Serbo, everything lives on a single screen. Charting, lab orders, prescriptions, and billing. No more tab overload or wasted clicks. Need to prescribe supplements, manage IV protocols, or send a refill straight from the chart? Serbo has got you covered. Want patients to schedule online, sign forms, or message you securely? Serbo's custom-branded patient portal makes it easy. Thousands of functional and DPC clinics trust Serbo to run their practice without the admin chaos. So if your current EHR is holding you back, it's time to level up. Visit cer.bo to schedule a demo and see what Serbo can do for your clinic. Healthcare communication today is overwhelming, with practices managing multiple disconnected channels, making coordination difficult for providers and care delivery frustrating for patients. Spruce Health solves this by unifying HIPAA-grade phone, texting, faxing, and telemedicine into one secure, easy-to-use platform. With Spruce, you can organize all communications in a centralized inbox, automate workflows, and collaborate seamlessly. No app required for patients. Missed calls are transcribed, messages can be scheduled, and urgent issues are routed instantly to the right care teams. Spruce is purpose-built for healthcare, securing patient data with encryption and robust privacy controls while offering flexibility through shared inboxes and tracking tools that support accountability and oversight. From solo practices to large teams, Spruce streamlines communication, improves efficiency, and enhances the patient experience. Start a free trial today and discover why thousands of practices trust Spruce for healthcare communication. Spruce, where healthcare communication counts.
Well, so for medications, either we would dispense in-house. And so with that, obviously, you want to make sure that your inventory is well managed and that any kind of ancillary charges, whether they're labs or meds, would be seamlessly billed through your billing platform rather than you having to re-enter that into the billing platform. I want all the systems to talk together and link so that you're not having any of your team members doing additional work that really isn't providing any really real value, some admin task that should be gone, that just leads to potential mistakes. So how to maximize that to make sure that your EMR system is communicating very efficiently with all the platforms. I mean, that's something that I'd really like to do. And then we either dispense in-house or I can e-scribe the med to the patient's pharmacy. And lab work, some patients decide to get their labs at our office. So when they're leaving the office, we'll have them schedule with our nurse, or we do have a phlebotomist who comes in part-time to help with, people love getting their labs in the office. So just to kind of give more time for that. And then I'll put the orders in the chart. So when they go see the nurse or phlebotomist, they're already in there. And so they know what the orders are.
That's awesome. And I hope that it just gives some people, especially the listeners out there who are newer to DPC workflows, it's very familiar in terms of how we did things in fee-for-service, but this is stuff that is definitely and can be even more streamlined. And in here, I want to point out one of the sections that we had in the toolkit in the Battle of the EHRs was highlighting satisfaction of different features. And when it comes to patient portal overall, and the people who answered the question on how good are patient portals of the DPC space, talking about their own EHR, that was
our lowest score a 2.94 out of 5. And so I go back to, this is a tool that we have that our patients engage with. It is part of how our patients experience the access to our care. I have a DPC doctor, and then I literally had to email her to say, I don't know how to cancel an appointment because there was no portal. And it's a huge thing for me because that is totally extra work. So I would love to focus on the battle of the EHRs, because now you got a copy. And again, if you did not get a copy, go to mydpcstory.com/magazine and look at the results in full. But looking in general at the results and being able to reflect on your almost decade in practice with the demographics at your clinic that you have, I'm wondering if there's anything that really stood out to you as, oh, absolutely, or that really surprises me. Anything in particular that stood out for you from the battle results?
Well, I think, I mean, I don't know if there's anything that stood out as shocking. I mean, patients do like the portal. They like to be able to have access to their chart and look at, hey, what are my recent labs? What are my vaccines? Because things come up and they have like camp forms to fill out, not that. And if they can go on and say, I got all my information right there, I didn't need to call anybody, I didn't need to get anything sent to me. They like the messaging. What surprised you in the results?
Yeah. So I think that one of the things that stuck out immediately was over 20% of people who are looking to switch. That one, like, it just gave perspective. And this is only 214 people who responded to the survey. And then one of the things that I really loved was looking at the top 5 reasons why people choose or why people leave an EHR. That was really fascinating because I think about these things that you're talking about, workflows, how the patient engages, what you would like it to do. It's very much in alignment with what everybody else is saying. Like the reasons to choose an EHR, 65% of people said they would choose an EHR, or they did, because of ease of use. And then when you look at the reasons why people left, limited customization, 32% said that was a reason to leave. That it is difficult to use their EHR. 42% responded that it is difficult to use, so they left their EHR. I mean, what I love about how we looked at the data and what it shows is literally, this is our community saying, this is the stuff that we need to make sure that our practices and our patients have good access and good experience. So those are the things that initially stood out. And then I think the other thing that stood out to me was that even though there was a quote unquote champion in terms of the number of categories that this particular HR won, I still think that if you actually read the entire EHR battle, you can see how there's no clear winner in this race, that we still need more innovation. Everybody's brain works differently. Some people need a portal. Like I am totally in that boat. Other people do not need a portal. Other people work well on a WordPad. I will die before I ever use a WordPad ever again. So it's like I think it's so relatable and it's very representative. And this was just our first year doing this. So those are the things that stuck out for me.
And there's a lot of new players, right? So
yeah,
part of it is, well, in the next few years, I'm sure as the innovation changes and as newer companies come in, they're going to come up with a lot of new things. But I think that usability, like how well is it working for me and my patients? And I mean, that's always going to be a major factor. And quite frankly, like probably will change as needs change over time, and how well did the EMRs adjust to it. But it is surprising how many people look at changing. But, at the end of the day, no EMR is going to be perfect. And like you said, they're very unique. People work in little different ways. For people who are kind of used to being in the system for a while, sometimes you need something that's still a little bit kind of like that because that's how you've grown up using that, this and that. And then other people are going to come out and say, I want something totally different. What I love about the EMRs for direct primary care is that they are not necessarily centered on billing. Whereas it's not about like, how can we code this to get the most money out of the insurance company? they have the freedom to say, how can we make this patient-centric as much as possible so that it works better?
Absolutely. When you say that, I think about how when you're really focused and your entire business model is focused on patient accessibility, affordability, quality, all the tenets of DPC, everything else falls in suit with that, right? If that is your mission, it really helps you see where there are problems. It helps you improve. And it literally is tied to the fact that we get to make the decisions of these businesses. We do not have to deal with using Cerner or Epic for another gosh dang day. So it's
Right.
so empowering to be able to not only want change, but also to make change.
Yeah. Yeah. And then the beauty of owning your own DPC is you don't have to like go through 17 committees if you want to change your EMR. Yeah, it might be a headache, but you can just decide, hey, I think our business model is going in a different direction. We need to do this, and you just implement it yourself and do it.
I love that. So if there are listeners who are coming off of the summit and they're like, okay, I learned a ton of things. Where do I get started with my tech stack? After our conversation, thinking about what we've said and thinking about your experience, what would you say to that doctor who's in the planning to year 3 in practice when it comes to tech stack rooted in an EHR?
Well, I mean, I think number one, I mean, if you've already started your practice and you're a couple years in, think about like, where are your limitations in your efficiency? What are things where you feel like, you know what, I feel like we're getting hung up here, and then start looking at ways, because there's a lot of different ways you could address that. I mean, if you're new to DPC and you're coming out of the practice, try them all. Because again, you might want an all-in-one, you might not want an all-in-one, and you want to put pieces together. They're all have different pluses and minuses. So try out all of them and see which one seems to get you in your groove the most. Because I think it is, a lot of it is very person dependent on the way that you think, the way that you feel like your flow should go, and that sort of thing. So I would encourage people to just look into all the different options and try them.
I love that. And yeah, that is exactly why we're having this conversation. That's exactly why the toolkit and the Battle of the EHR exists, to help people have more input as to the opinions of our community, to help them understand and find relatability when they're choosing tech. And I will say there's an entire article entitled Battle Tested the EHRs that really get you through years 0 to 3. And the amazing Paula Tomzik, who is the clinic manager at Car Direct Care, talks about shifting from one EHR to another. And it's like you said, it's not a fun experience. There's a quote in here that is not too friendly for little ears that people said about the transition. And so that matters. In this magazine, we talk about 3 different practices. Dr. Hoke is a rural college town physician in Ohio. Dr. Sarah Schuster is in an urban practice with multiple physicians. And then Dr. Phil Boucher has a practice that's pediatrics in Lincoln, Nebraska, and is very tech focused. So there's so many ways to just reinforce that this decision to choose an EHR is so personal. And you're not locked in forever, but just do know that there's more information. Rewind, listen to Dr. Haug's comments here, and just be intentional about your practice and your patients, because it literally affects both you as the practice owner or a physician at the practice, as well as your patients for the perpetuity of your DPC practice.
Yeah, but like you said, you're gonna modify those systems. You're gonna modify your workflows constantly. We can always improve, right? We can always get better.
100%. Awesome. Thank you so much for coming on today and talking and reflecting about your experience at the DPC Summit.
Yeah, thanks for having me. Good to see you.
Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the Daily, check out dpcnews.com. Until next week, this is Marielle Conception.